Welcome to the UT Health East Texas Virtual Education Series. Today's presentation topic is Type 2 Diabetes, What You Need to Know, featuring Dr. Kurtis Kostan, board-certified internal medicine physician at UT Health East Texas Physicians Clinic on Three Lakes Parkway in Tyler.
Hi everyone, my name is Kurtis Kostan. I'm an internal medicine physician with UT Health East Texas. I work over at the Three Lakes Clinic. Today I just wanted to give y'all a brief presentation regarding type 2 diabetes and what you need to know about it. Okay, so let's go ahead and get started. So first off, we've all heard of diabetes, but what is diabetes? Well, on a basic level, our body is made up of trillions of tiny little things called cells. Now these cells, they use sugar to make energy for us. So sugar travels through our bloodstream and it gets brought into the cells to then be converted into energy. But the sugar actually needs help getting into the cells. It can't do it on its own. And so that's where insulin comes into play. So insulin is a hormone secreted by your pancreas that actually helps the sugar get into the cells and then be used for energy. So in diabetes, this is where the problem goes wrong. So there's either a lack of insulin or there's insulin present, but it's not working properly. And the net result of either one of those is the sugar can't get out of your bloodstream and into the cells to be used for energy, resulting in high blood sugars. So there's two main types of diabetes I kind of just touched on. So the first one's type 1 diabetes. And this is typically seen in younger patients and adolescents. And so what happens in type 1 diabetes is the body just simply does not produce enough insulin or any insulin at all. In type 2 diabetes, this is something that we actually see in more elder and overweight patients, okay? What happens is your body produces insulin, but there's actually a decreased sensitivity of the receptors for insulin, meaning the insulin can't do its job correctly. And so it's unable to actually let the sugar into the cell to be converted into energy. So why should you care about diabetes? Well, we've all heard of it, and it's actually becoming even more common. So this is a graphic that I found from the World Health Organization. So it's estimated that from 1980 to 2014, the number of adults with diabetes rose from 108 million to 422 million. That's almost 4 times the amount in about a 34-year span. And it's roughly about 1 in 11 adults worldwide have diabetes. And so why does it matter if I have diabetes? Well, it can actually lead to death. It can kill people. In 2009, they estimated that 1.5 million deaths were directly attributed to diabetes. And then even if it doesn't kill a person, it can actually cause significant complications like blindness, heart attacks, strokes, kidney failures, and it can even lead to amputations of legs. So that last slide was talking about the world as a whole. This one focuses a little bit more on diabetes in the United States. So for the United States, it's estimated that 34.2 million adults have diabetes, which is 10.5% of the population. So that's actually about 1 in 10 adults will have diabetes. And it's an even larger number if you look at a group of people called pre-diabetics. And now what you can think of pre-diabetes as is people that they don't have normal blood sugar levels, but they don't quite meet that diagnostic level for diabetes. They're kind of in that middle ground where they have elevated blood sugars and they're at really high risk for developing diabetes. And for pre-diabetes, it's estimated there's 88 million people, or 34.5% of the US population. So that's roughly like 1 in 3 adults that will be at least pre-diabetic. So looking at this graph right here, this just kind of shows how increasingly more common diabetes is becoming in our population. So if you start at the beginning in 2004, you see that it's kind of nice, lightly colored with some dark areas down in the south. And as you progress to 2016, you can see it's becoming increasingly darker as a whole, which as you see by the graph, that means that there's a higher percent of people with diabetes in those areas. So as a whole, the United States is becoming more and more diabetic. So how would someone know if they might have diabetes? What are some of the signs and symptoms to be on the lookout for? Well, these first two right here, increased thirst and frequent urination. These two things kind of go hand in hand. So your body is not equipped to handle high levels of blood sugar, especially your kidneys. When you have high blood sugar levels, a lot of that sugar actually spills out into your kidneys, and you actually have a lot of increased sugar in your urine. And that actually ends up pulling a lot of water along with it. So you actually end up going to the bathroom more, and then when you're losing all of that water, it makes you dehydrated, which makes you feel thirstier. So those two kind of go hand in hand. You also have increased hunger because your body, those cells we talked about that are wanting sugar, they're not getting it. And so they're kind of sending this response that's telling you that, hey, I'm still hungry, I still need some more fuel. So it makes you have some increased hunger. And this actually kind of sounds a little counterintuitive, but you can actually get some unintended weight loss as well. Because as we talked about, insulin plays a role in letting sugar into the cell, but it also plays a role in fat accumulation. And so if your insulin receptors aren't working properly, you actually have a hard time storing fat. So you actually can have some unintended weight loss as well. It also leads to just fatigue, and then high blood sugar levels can also lead to things like blurry vision. You can have slow healing sores because it can affect some of the blood flow to your legs and your extremities. It can lead to frequent infections, especially with things like yeast and fungus that tend to thrive in high sugar environments. And then it can damage your nerves and lead to things like numbness and tingling in your hands and your feet. And there's actually a little sign that you can see sometimes. Look at these areas of darkened skin, especially in the armpits and in the neck. So who's at risk for type 2 diabetes? Well, one of the biggest risk factors is actually being overweight. As we get overweight, this has a role in decreasing the sensitivity of our cells to insulin. And not being physically active as well. Those two things kind of go hand in hand and decrease our cells' sensitivity to insulin. Family history plays a role. There is some genetics that go along with this. So if you have a parent or a sibling that was a type 2 diabetic, then you're also at risk for developing diabetes as well. Fat distribution actually plays a role. So not just obesity, but people that tend to store their fat more in their abdomen as opposed to their hips and in their thighs, they're actually at a higher risk for developing diabetes. And then we've learned things about race and ethnicity. So Black, Hispanics, Native Americans, Asians, and Pacific Islanders, they're higher risk as well. And then age plays a role, especially after the age of 45, you're at an increased risk. And then pregnancy. So if you were someone that got diagnosed with diabetes during pregnancy, we call that gestational diabetes, or if you gave birth to a baby weighing more than 9 pounds, you're actually at an increased risk of developing diabetes later on in life. So how do we diagnose type 2 diabetes? Well, the most common thing that we as physicians look at is called hemoglobin A1Cs. Now what this is actually a percentage of the amount of red blood cells in your body that actually have sugar coated on part of it. So we check the hemoglobin A1C, and that spits out a number to us. And so if you look over here for diabetes, if you have 6.5% or above, we call that diabetes. And normal is going to be 5.7 or below. And so we have this middle ground right here as well, where if you're in that range 5.7 to 6.4, that's what we call the pre-diabetes. And like I mentioned previously, those are the people that are just at a higher risk for developing type 2 diabetes. So that's the most common one that we use. There's also a couple other tests that we can check. Fasting blood glucose, so that's just what your blood sugar is when you haven't eaten anything. Normal is less than 100, and diabetes is going to be greater than 126. There's something called a glucose tolerance test. That's where we give someone a sugar load, and then we check their blood sugar 2 hours later, and then based on that result, we can see whether or not they're diabetic. And also, if someone has a random blood sugar level drawn and it's greater than 200, but they have symptoms of peeing a lot, drinking a lot, some of those symptoms we talked about earlier, that would be diagnostic of diabetes as well. So who should get tested? Well, all adults over the age of 45 should get tested because like we said earlier, age is a big risk factor. So anybody over the age of 45, it's recommended that they get tested for diabetes. And any adults under the age of 45, if they're overweight or they have any of those risk factors that we talked about. And then also anyone with symptoms suggestive of type 2 diabetes should get checked also. So how do we treat type 2 diabetes? Well, we typically have a stepwise approach. in managing type 2 diabetes. So everybody, regardless of how bad their diabetes is when they're diagnosed, is going to get what we call lifestyle modifications. And this is going to be your diet and exercising. It's always really important that you follow a diabetic diet. You can keep your blood sugars from going really high by not eating so many sugars. And then exercise plays a really important role as well. That can help with increasing the insulin response on your cells. So after lifestyle modifications, the next thing we jump into is pills. We have pills that can actually increase the insulin sensitivity, and we also have pills that can work at different parts in the pathway to help lower blood sugar levels. If pills aren't enough, then we go to injectable medications. So we've all heard of insulin, but there's also some medicines that are injections that aren't insulin that can help lower your blood sugar levels. And then if that's not enough, then we resort to insulin. So why is it important to treat type 2 diabetes and get your blood sugar under control? So your body is just not happy when your blood sugar is really high. It can lead to a lot of problems with a lot of different organs. So if we start right here, so it can cause a lot of damage to your blood vessels. So if you look at the smaller blood vessels in the body, it can lead to damage in your eyes, and it's actually the leading cause of blindness. And if it damages some of the blood vessels in your kidney, it's called diabetic nephropathy. And if that gets bad enough, it can actually progress to renal failure and needing dialysis. And then it can also damage the nerves in your legs. And that can lead to that pins and needles and numbness and tingling sensation that you get. And then if you look at some of the bigger blood vessels that high blood sugars can damage, it can damage blood vessels in your heart and lead to heart attacks. It can damage blood vessels in your brain and cause strokes, and then it can damage blood vessels in your legs. And that can lead to, like we talked about earlier with poor wound healing, that if that gets bad enough, you can actually end up getting a leg amputated. It's actually one of the leading causes of amputations as well. So it's really important that we get those blood sugars under control. So is there anything you can do to help prevent type 2 diabetes? Well, yes. Like we talked about earlier, diet and exercise, those are really, really, really key to getting diabetes under control. So diet, good food selection, and weight loss if you're overweight. I'm going to go into diet in just a second, a little bit more. And then as far as exercise goes, 150 minutes per week of moderate intense physical activity. This will help improve that insulin sensitivity and allow your cells to bring sugar out of the bloodstream for you and use that for energy. Okay, and then in regards to diet, these are just going to be some basics regarding diet. So things you want to really try to emphasize. You don't want to avoid carbs altogether. Your body needs carbs. Like I said, that's what it uses for fuel. But you want to try to choose healthy carbohydrates. So try to get them from things like fruits and vegetables, especially some non-starchy vegetables, and then whole grains. It's also important to eat high fiber foods as well. And then you want to try to get, things like heart-healthy fish, tuna, salmon. And as far as fats go, you want good fats, which are going to be the monounsaturated fats and the polyunsaturated fats. And you can find those in things like avocados and nuts. And then you want to try to avoid whole foods and not processed foods. So things to avoid, like I said, you want the good fats, the mono and polyunsaturated. You want to avoid the saturated and the trans fats. Try to avoid things with high cholesterol, high sodium, anything with added sugars, refined grains, or any kind of processed foods. And so this is from the American Diabetes Association. This is what they call the plate method. There's a lot of different, diabetes recommendations out there for the diet, but this is from the ADA. So they recommend that an ideal portion would be a 9-inch plate, and then you fill half of that plate on one side with non-starchy vegetables. Those are things like asparagus, artichoke, broccoli. They're just generally lower in carbs, and they have a lot of vitamins and nutrients that go along with them. And then you want to take a quarter of your plate and fill that with lean protein foods, things like chicken and fish and eggs. You try to avoid animal fats like red meat. Those tend to have higher concentrations of saturated fats. And then the other quarter of your plate that's where you're going to get your carbohydrates, your yogurts, milks, rice, other grains like that, bread. And then as far as beverages go, it's really best just to do water or any kind of low-calorie drink and avoid those high-sugar things like juices or sodas. I want to thank you all for joining me today. I hope you've learned something, and I look forward to seeing you in the clinic. So here's some questions that we've received. So, can I reverse my diabetes? In a sense, yes, you can. So, like I said, the main problem with type 2 diabetes was decreased insulin sensitivity, okay? As you get overweight and sedentary, you lose that sensitivity of insulin on those receptors. But if you start eating better, if you start losing weight, if you start exercising, you can actually get some of that sensitivity back. And your body can actually become more responsive to insulin again. So in a sense, you can reverse some of that process that's already started happening. So will I have to check my blood sugar each day with type 2 diabetes? The short answer is it depends. It's typically only recommended to check blood sugars if you're needing insulin therapy. For most patients that are just on pills or non-insulin injectable medications, it's generally not recommended to check your blood sugar at home.
We hope you enjoyed the presentation today. For more information about scheduling an appointment with Dr. Kostan, call 903-747-4098 or visit uthealthiestexasdoctors.com. Our next virtual seminar will be announced soon. Follow us on Facebook to stay up to date on upcoming events and seminars. Thank you for joining.